Welcome back to Steele and Vance. These are visuals of West Broadway in Vancouver yesterday, a protest outside of now Premier David Eby's constituency office. There was some serious vitriol being spewed there in the big white trucks with the upside down Canadian flags and the misspelled.
What was it? I don't even know what they were protesting. Are they still protesting vaccine mandates? What are they mad about? And
Everything.
Interestingly, there's a connection to our first guest, Connie Smudge, the drag queen, because the protest outside the Coquitlam Library, one of the loudest people with the bullhorn who was angry at the Connie protest was also at the protest outside David Eby's office. So what are they mad about? Who knows? But we are so pleased to have BC's new Premier David Eby in the studio with us. Thank you for making time for us.
Well, thanks for having me. Yeah, cheers.
Yeah, cheers. And you have what, a BC pop there? BC made pop?
Karma.
Yeah, this is a Karma,
nice.
Karma fruit drink. Yeah, farm family in the Okanagan. So.
Love it.
Yeah, cheers.
Can you speak just after you have a sip to the polarization and the anger, and everybody seems to be mad, and I think there was an anti-vaccination piece to that where they're angry that healthcare workers still have to be vaccinated. Go figure. What do you make of it all?
Well, it's in my experience, it's a relatively small group. I've been across the province, and most British Columbians, they're looking for solutions. They're not so ideological. They want to know that government, for example, is working in their interests, is listening, understands what the issues are. And it's been interesting because when you're on social media, it's like, man, people are really ripping each other apart. But when you're out in the community talking to people, it's different. And I just came from the Truck Loggers Association. Here's a group of people who make a living out of the forests. The old growth policy has huge implications for them. Our government has put that forward. It's, it's existential for some of them. And here's the guy who's the new guy for the government coming up. And applause coming up, like, we want to talk to you, we want to engage on these things, and just a real spirit of, and look, we're a bunch of environmentalists in our group and we care about the forest too, and so finding that common ground, I think, is the opportunity, and it's not going to be on Twitter or social media.
And figuring out the labor piece is a big part of that issue, similarly to healthcare, which I think hits every British Columbian, but not unique to BC, certainly. The struggles in a healthcare system and trying to find solutions, and even the most basic solutions of, I don't have a doctor, which so many British Columbians say right now. Yeah,
that issue of shortage of family doctors is huge for people. My wife is a family doctor, as you know. She used to be a nurse, and it's very rare for us to be out in the community and somebody not say, like, you're taking new patients, we're looking for a family doc. And I'm very hopeful that our new agreement with the family doctors is going to encourage more family doctors to take more patients and to come out of different areas of practice back into community. I think it'll make a big difference, but also recognizing the credentials of doctors that are internationally trained so they can get to work, including under the supervision of a BC doctor as they come up to speed on BC practice. It's going to make a huge difference.
That's a great point. Even under the supervision of a current BC doctor so that they can get up to speed, because that's the...
Right.
They've got the skills. I was out in Chilliwack. I was hosted when I was doing a tour of the province for the leadership race at a couple's house. And he was a physician, a surgeon, and she was a dentist. And both of them worked for the local school board, not in their professions because their training experience was all in Pakistan. And, they have skills that could easily be put to work in our healthcare system if they had the support to get out there and do it. And that's what this agreement is about. It's not about, some people say, oh, I don't know, lowering standards. It's not about that. These are folks that if you were in the United States or you were somewhere in Europe and you saw this nurse and you'd be like, thank you for the help.
Right. You'd be happy to have it.
And so recognizing their skills, training them up in the areas where they're short, but also, as you say, like getting them on the floor, getting them off the sidelines, supporting people. Like that's what we're doing right now, and it's literally thousands of nurses right now that are going to be accelerated through.
Which is fantastic. Ontario is doing two things that are interesting right now. One of them is that they're bringing in legislation to allow out-of-province healthcare workers to practice in Ontario without having to register. What do you think about that? Could BC look at something like that?
Yeah, we're looking at absolutely everything to get those healthcare workers that want to be working, that have the skills onto the floor right away. But we also have to look down the line. Our province is growing so quickly, as I'm sure you've been talking about this. But the demand is massive, so we're opening the first new medical school in Western Canada in 50 years. that will be focused on training people for community medicine. A lot of people go to medical school and they start off, I want to be a family doctor, I want to help people in the family practice clinic. They come out the other end, I want to be a specialist, I want to be a neurologist, I want to be this kind of, and so this school really focus on the long term for our province, training people up in the schools out in Surrey, rapidly growing community, and it's going to make a big difference.
And just the second half of that question is, Ontario is also now taking, to address the waiting list backlog, letting private clinics do some of these backlog surgeries, but being paid for through the public purse.
Right.
BC has done that. Are you looking at doing more of that? Because BC has some of the longest waiting lists in the country.
Yeah, we've actually gone the other direction. We've bought out the private clinics and brought them into the public system, MRIs and so on, running them 24 hours in the public system. And just before the pandemic, we were chewing our way through those backlogs using those systems. We've recovered 99% of the backlog from COVID.
That's amazing.
Which is amazing.
99%.
Yeah, it's incredible. And we've got a lot more work to do, though. We are not going to go that route of private clinics, because one of the things that I really worry about is you open a private clinic, where are the staff coming from? The issue we're facing is the shortage of people. So you pull people from the public system that are working and you put them in the private clinic, and then you have a profit margin as well you're paying for. How are we ahead?
Yeah,
so we're really focusing on getting those people into the system to support our public healthcare system.
Let's slide from that simple problem into another problem that is, really glaringly exposed over COVID in particular, is the affordability crisis, the housing crisis, the homelessness is tied into that, health, wellness, addiction, all of it is like coming to a head, knowing as one of your constituents how close to your heart housing as a human right is. What can we possibly do urgently? I know you've made a number of moves already in your short time as Premier, but this is something that has been ignored by the federal government as well for a long, long time.
Yeah, it's a profound challenge, and one of the big shifts we've made around housing in this province is to say, we used to be really focused exclusively on the poorest of the poor, on the social housing, on homelessness, and we put about $1 billion into initiatives, opening social housing and supports for people and so on. And homelessness stayed at about the same level in our province, or just decreased slightly. And so it's pretty clear to me and to everyone in our government, we need to move upstream. And that means being involved in middle class housing. It used to be that governments were involved in building. I'm sure some of you know people who live in co-ops that were built in the 50s,
absolutely.
60s, 70s.
Absolutely.
The west end of Vancouver, a bunch of buildings built under a federal tax shelter program called the MERB program, very technical, but basically it was a Fed saying we got to support the construction of middle income rental housing. And lots of people living in those buildings now, and then governments just stopped doing it for 20 years. And so we're going to get back into supporting that middle class housing in a big way. People with decent wages can't find a place to live.
No, it's crazy. It is. Can we talk about two things that a lot of people are musing about these days? One is the renter's rebate promised, I think, in 2017. Where is it? Why is that so complicated? And also the homeowner grant, with the threshold being bumped up to 2.1 million, I think. And you have the inevitable complaint about why should someone who's sitting on a $2.1 million home get a homeowner rebate. Where do you sit on those two things?
Sure. So the renter's rebate was one of our commitments in the election campaign. We're going to deliver on those commitments. And there are a bunch of affordability commitments that we made during the campaign that we're going to deliver on. Free birth control is another one. The challenge around the renter's rebate is, amazingly, we don't have the data on who a renter is in the province. We have to set up that system to know that people are renters. The lack of information that governments have about housing, the number of rental units, or even what's happening in housing is astonishing. So we've set up different systems to be able to do that, and we're in a position to be able to
Is there a
to get there.
target deadline for that? Like, that's
we're
the
gonna
most asked question on our Twitter feed, on our Facebook page, on all the things. It's like, when is that happening?
I would love to make the announcement right now.
I know.
Please.
You're free to come back anytime and make an announcement like that.
But it's front of mind for me. Supporting renters is really front of mind. That's why we put money into the residential tenancy branch. And on the homeowners grants and other initiatives, there are an array of government programs. Our government is really focused on supporting British Columbians with cost of living supports. Right now, we're not focusing on taking them away from people. And so we are continuing with the homeowners grant program. But I think renters need to be treated fairly as well, and they need to be recognized.
You're looking at means testing the homeowner grant?
So the policy work on the homeowners grant is happening right now, and I look forward to making an announcement.
Oh, okay.
We're gonna have him back. He's coming back. You know what?
More
He's
to
coming
come
back
on
in the next segment.
Yeah, because we have so much more to talk about. We want to talk about crime, prolific offenders, addiction, decriminalization. Premier David Eby is going to stay with us for another segment. Stay tuned for that.